Marhaba and welcome to another episode of The Doc is In. And today we're shedding the light on a condition that affects millions of women, yet remains vastly underdiagnosed and misunderstood. It's the lipedema, or in Arabic it's called al-wadma al-shahmiyya. So what is this disease? Is it just fat accumulation? Why does it hurt? And why do so many women get misdiagnosed or dismissed? I'm Dr. Safa, consultant internal medicine and obesity medicine, and I'm joined today by my colleague, Dr. Batool, consultant internal medicine and vascular medicine, and also Kristina. She's one of the best lipedema physical therapists here at Cleveland Clinic Abu Dhabi. Together, we'll be unpacking the myths and the truth about this disease, the latest medical insights, and what patients really need to know about this disease. From symptoms to diagnosis to patient's treatment journey here at Cleveland Clinic Abu Dhabi. And so if you're a healthcare provider, a patient with lipedema, or know someone with lipedema, this episode is for you. Welcome.
Thank you.
Thank you.
So Dr. Batool, I'm going to start with you. What is lipedema?
That's a great question. Thank you, Safa. So for starters, lipedema is a chronic condition. This chronic condition describes the accumulation of abnormal fat cells in different areas in the body. In most patients, it would either accumulate in the lower extremities or in the upper extremities. But those fat cells are not normal fat cells. So those fat cells are abnormal. And that's why patients would present to the clinic with lower extremity swelling, fatigue, tenderness on palpation, skin changes like easy bruising when someone touches their skin, or sometimes bruises that appear for no reason at all. And that's why lipedema is usually misdiagnosed. A part of the reason for the misdiagnosis is, as you mentioned earlier, the lack of awareness. But another reason for misdiagnosis is usually it's actually mistaken for other conditions,
Right.
like lymphedema and like simply obesity.
Right.
Now, at the Cleveland Clinic in Abu Dhabi, we're very lucky to have a multidisciplinary pathway team that involves different teams, including vascular medicine, obesity medicine like yourself, and physical therapy like Kristina, and surgical options if necessary and if applicable for the patients. Now, all of those teams together, we work very closely in order to help those patients with lipedema manage their symptoms and make their life a little bit easier. And I know that Kristina is here with us today to tell us a little bit more about the magic that they do with physical therapy.
Well, from a physical therapy standpoint, once these patients are in the pathway or joins the pathway, then we conduct a thorough physical and functional assessment. And from there, we design a very individualized, tailored exercise program where we focus on reducing discomfort, improving mobility, and enhancing, of course, lymphatic flow. Apart from that, we also teach them lymphatic drainage techniques and give them guidance on use of compression therapy to help them overall manage their symptoms.
Okay, very good. Can you explain a little bit more about the compression therapy?
So with compression therapy, we either, provide them or prescribe them with the right medically graded compression stockings. And as well, in terms of compression therapy, we do lymphatic drainage, that's one part, but also we provide them with a compression device that they can use at home that can even and help them way more to manage even at home.
Very good.
Yeah.
Okay, awesome. Dr. Batool, when someone comes into Cleveland Clinic, how can he be integrated into the pathway that we've created for the lipedema?
Absolutely. So I think there's a different ways for those patients to get integrated into this pathway. And I think the key of getting part of this pathway is the correct diagnosis. So as we have mentioned earlier, the lack of awareness, not only within the society itself or within patients itself, but also within the medical field about lipedema has been creating a little bit of challenges for those patients to get into the right pathway. Absolutely. And that's why we get a lot of patients in our clinics that they would tell us, we've been dealing with this for our entire lives, but no one has ever told us that this is lipedema.
Right.
Some people have told us that this is just a part of obesity. We've been trying to lose weight. It's not really working. We don't know where to go from there. And their situation gets worse with time. And especially when we're talking about women, because with the hormonal changes that occur with them during their lifetime, those changes affect them a lot. They affected their mobility, their quality of life, their well-being, and their psychological quality of life as well. So I think that a part of this is the awareness, which has been a challenge for us to get those patients into the correct pathway. But we do get patients that get self-referred. Now with the increased awareness in the social media and increased awareness in multiple platforms, a lot of patients patients have been hearing about those conditions from their social
yeah.
media platforms, and they would come to your clinic
Mm-hmm.
and they're like, I saw this person talking about this thing, and I think that I actually
Yeah, I
have
have
it. She practically answers all the questions that I have been asking myself my entire life. And then we also get a lot of referrals nowadays from primary care providers. We got a lot of referrals from obesity medicine clinics. We get referrals sometimes from physical therapy as well. And general surgery refers a lot of those patients to us. So I think this is the way those patients can get into the pathway of lipedema that we have at Cleveland Clinic in Abu Dhabi. But if there is something that I would advocate for and I would highly advise for today, is that if any of the people that are hearing us right now do have lipedema, or they do think that they have any of the symptoms that we mentioned earlier, or they know someone who has any of the symptoms earlier, it's really good to get evaluated by a vascular expert or an obesity expert or a lymphatic expert that could help tell them if this is lipedema versus something else. And as I mentioned earlier, if you feel like you do have abnormal fat accumulation inside your body, which is really hard to get rid of, and you have been labeled as obese and tried multiple things that have not been working, then you might be having lipedema. So it's a good idea to get that checked up. And I know that this is one of the complaints that people come to your clinic, Safa, for.
Yes,
so can you tell us a little bit more about it?
Absolutely. I want to highlight where women think that is obesity or actually water accumulation, because they're not born with it. It happens when there's a fluctuation of the hormone, like you said, and it's mostly in women. It's almost exclusive in women, but we do see a little bit of men that has it. So what happens is either they start having it or seeing it when they were like teenagers or after pregnancy or when they go through menopause. And because they're not born with it, it comes later on. They don't know like if this is actually because the weight they gained during that period. Yeah. And I actually see women in their 50s, 60s, 70s, they've been having this disease and they've never been diagnosed. And I see women actually on water medication, diuretics. They take, they've been prescribed Lasix and water medications. They think it's a water accumulation to get rid of that, and actually it's not water. So yeah, I do see them. Sometimes I diagnose them in my clinic, or I get referral from you guys in the clinic. It's very important to explain to the patients that weight loss does not get rid of it because it's a genetic disorder. It might help you with the weight loss. So weight loss is important as part of their journey. It decreases the heaviness and the pressure on their joints. So when they lose weight, they feel lighter to exercise and move more. It's just not the treatment for it, but it's very crucial in their journey to treatment. I do use these new medications, the injectables, the GLP-1s, what we call the semaglutide. It's known in the market for Ozempic or Wegovy, and also the Mounjaro. So these medications help in two ways. First, they help with decreasing the weight by decreasing their appetite, controlling their portion, and decreases the calories that they eat, so they go into calorie deficit and help them lose the weight. And second thing, these medications have been proven in the study to decrease inflammatory markers. So we think that it can help decrease the inflammation that they have in this fat tissue. And from that, they can actually improve their symptoms, the tenderness and the heaviness and all that. So losing weight is crucial, but it's also important. It's not a normal weight or fat accumulation in these patients. In terms of diet, I also always recommend the anti-inflammatory diet, which is that decrease the inflammation, like the ones with less processed food, whole food. They have more of the good fats in it and a decrease of the carbohydrate in general, but also in the sugar and processed food. So this is also important. Kristina, tell us about how the patient feels after the sessions with physical therapy. How much does it impact their health?
Well, actually, it's been transformative. Most of them, they say it's literally life-changing, because before getting diagnosed, they feel that, they have lost ability at all to do their day-to-day activities, and that pain and tenderness on the limbs just start to take over. So for us to actually give them the right tools of, giving them the right compression therapy techniques and items, as well as giving them correct exercises that they can do, and also teach them these self-lymphatic drainage techniques, they kind of feel empowered. It helps them improve their quality of life overall, improve their mobility, and the results have been really profound. So.
Right.
we always thank you for referring them to us.
Yeah,
We actually thank you guys for the great work that you're
Yeah.
doing with our patients.
Right, absolutely. Also, these patients have weak muscles because of
They
the
do.
heaviness. They do have weak muscles, and they go into a vicious cycle.
That's
so the
right.
weak muscles, they don't move as much, and this get worse and worse. So it's very important for them to move and improve their muscle mass.
It does, and when they're in the program, like what you mentioned, together with weight loss medication and proper diet, and them attending to the program, they feel lighter. Like what you mentioned, they feel lighter. They feel that they're able to do more during the day, and that's what makes it better for them overall.
Right. I feel like the sad thing here, it's again, I'm going to highlight this underdiagnosed.
Yes.
Yeah.
And can you tell us, Dr. Batool, why do you think here in our community we see a lot? Like more than I would see in other places, but it's really underdiagnosed. Why do you think this is happening?
I think the reason for underdiagnosis is a lot of different factors that contribute to that. I think one of the things is, as we mentioned earlier, it's a genetic condition. So most of the women that would actually have this problem would notice that their moms, their grandmas, their aunts do have this similar problem. And there's this misconception that this is just my body physique. This is just my body type, the way my body looks. But technically speaking, that's not always the case, and especially when it comes with symptoms that are affecting the quality of life of those patients.
Right.
The other thing is because of the conservative nature of people in this country. So I think a lot of things are not really exposed a lot, and therefore this practically decreases the chances of having a timely diagnosis and a quick diagnosis. And as we mentioned earlier, the misdiagnosis and the lack of awareness also contributes a lot to the underdiagnosis of this problem.
Absolutely. Even in the medical field.
Absolutely.
Yes. Yeah.
That's right.
I think it's also very important for us as physicians and healthcare providers to educate ourselves about this disease.
Absolutely.
And so we'll be able to help our patient. There's one thing I also wanted to highlight, the psychological effect and toll that this disease has on patients. I've seen patients, they start crying when they know that they have this disease. Have you encountered this as well?
Absolutely.
A lot.
Yes. Yeah. What do you think? How can we support them? How can they get help?
Lipedema has been known to cause a lot of psychological problems for those patients because it is a chronic condition that interferes with patients' everyday lives. And as you guys mentioned, with the reduction of the weight or the physical activity, once people start feeling that they're more mobile and they can get around, they feel like their overall well-being is improving. And especially when it happens in younger patients that want to move around, they don't want to stay sitting or to have those symptoms that are just preventing them from carrying their everyday life activities appropriately. So yes, we've seen a lot of those patients that would come to our clinic. We would provide them with a diagnosis and they would start crying. They would be very emotional because this is a question that they've waited their entire life to have it answered, or because they've been blamed for their weights their entire life. And they're like, I'm literally eating an apple a day and running for 5 hours, but I'm not losing it, and it's very painful. So I think addressing the psychological well-being of those patients is extremely necessary. So talking to them, making them understand that it's a chronic, genetic, pathological condition is very essential, and helping them throughout the way to understand their symptoms, especially when it comes to getting them into support groups.
Right.
We do have a couple of support groups that patients get into. They talk to each other. I know that a physical therapy has also been doing some social physical therapy together, like a group physical therapy
so
together.
we are actually, we're in the process of creating a lipedema physical therapy group class because we've been having these kinds of sessions, and we're seeing a really high demand. And again, the psychological aspect of it being conscious of what they look like. So then putting them all in the group, doing the exercises together, kind of creates that bond amongst these ladies, and they can share tips on how, what works, what doesn't work, and, let's all exercise together, having that kind of comfort zone between all of these ladies. So it does help not only exercise, but like what you mentioned, talking to them, listening to them, understanding them, and then giving them the right tools to help them manage the symptoms that they have from
Very
lipedema.
Good. I feel like once we give them the diagnosis, they do have closure. Like they know it's not my fault. It's something I have no control over. So it's a lot of mixed emotions, that they're frustrated also because they can't do anything about it, but they know it's not their fault. So it's the support group is very, very important.
It is.
I wanted to ask, do you give them exercises to do at home or only during the session?
So we do the exercises with them, and then we do give out a video link or a sheet of exercises that they can also do at home. And then with them, highlighting the importance of wearing their compression stockings or their garments while exercising, keeping them hydrated when they exercise. Yeah, that's what we provide.
Yeah, and I know, Dr. Batool, you mentioned even the measurement of their thighs get better when they're compliant, right?
Absolutely,
so they do see changes in the numbers when they are compliant with the sessions in the compression therapy. Right?
Because we do measure them. That's part of our assessment. We do measure their legs during the initial assessment, and then we measure them afterwards, and we see literally profound changes in the size, at least, of the girth of their legs. For sure.
Very good.
And also like the changes in the symptoms that I would say a lot of patients mention after going through this pathway. So we do have a percentage of patients where the sizes themselves, they don't really change that much. They change just a little bit, but then the symptoms, they improve a lot, which really means a lot to the patients. Like they would come to your clinic and they're like, now I can move, now I feel lighter, I don't have the symptoms that I used to have, so I feel so much better.
Okay, that's awesome. That's very informative discussion. Thank you, Dr. Batool and Christine, for joining us today. We hope this conversation sparked awareness, answered some questions, and most importantly, empowered you to advocate, whether for yourself, for your patients, or someone you love. Thank you.
Thank you.
Thank you.